And our first presenter is Dr. Lorraine Weatherspoon. She's a professor in human nutrition and director of the didactic program in dietetics in the Department of Food Science and Human Nutrition at MSU.
Nutrition in a hospital level is just the tip of the iceberg. So I now call myself, from a practice as well as research perspective, a community-based clinical nutritionist, because I'm interested in clinical outcomes, but most certainly think that it's also important to consider the community. So my topic is food and health across the lifespan. That had to be creative as well, because he didn't want us to talk about everything in our research. And so I also do work both locally in the state of Michigan as well as beyond. So I'll mention some examples from both. So when we think about food, nutrition, and health, one of the things that I always say from a nutrition and health perspective is that be interested in food. This is a food talk. We also, when we talk about food, we need to think about physical activity. So we want to know how much of energy is involved in using some of that food, especially the extra calories and the concerns that we have about obesity and other things. But we can see, and I'm not going to go through everything in the slide, that there are a variety of other factors that also impact food, nutrition, and health. And some of them we can control, some of them we cannot control. The moral of this story is that my work is really interdisciplinary. I can't do my work if I don't consider some of the other aspects that relate to food, nutrition, and health. So from a food-specific perspective, some of the things that I look at with the data that we collect and the data that we analyze is food acquisition, choices, as well as availability, food preferences. What are things that we would think about relative to that? Specifically, what are foods that individuals buy, choose? What is it that they have preferences for? Where do they get these foods? Dr. Ham was going to be talking a little bit later on. We'll talk a little bit more about especially access to food. Is there a sufficient amount every day? Is it safe? Is it possible to get the foods that are necessary, especially for those related to health? Because we can make a lot of recommendations, but it does not necessarily mean that sometimes it's easily able for us, for individuals to implement those recommendations. So what are some of the barriers and facilitators that individuals face? And then what might be some associated health outcomes? So some examples from the work that I've been involved in, I've worked a lot in the area of childhood obesity, but also child undernutrition from an international perspective, but also domestic perspective. We look at, I'm very interested in underserved communities. So something that's very important to us is what happens right from the very beginning. So early childhood, when I think about things that happen during breastfeeding, I have a doctoral student that's working in the Detroit area with breastfeeding, especially in the African American community right now. We look at early childhood, another doctoral student who works for Extension and is doing her PhD, but she's also looking at feeding practices in early childhood centers. And we've also done some work in area of Flint with trying to develop curriculum, especially we call it healthy kids, healthy families, meaning that children don't live alone, they live in families, they live in environments that need to be taken into consideration. That's just in a nutshell. The other area that was actually the foundation of my work when I first came to Michigan was the area of type 2 diabetes in children, which is something that is a serious problem now, was something we didn't see many, many years ago, but we're seeing it more often, especially as it relates to childhood obesity, and then of course diabetes in adults. And again, from some of the work I said, I work interdisciplinary, and from a community perspective, I work very much with Extension. And one of the projects we had was a project called Diabetes Health is in Your Hands. And some of the pictures that I have up there are taken from their project, where we developed a community-specific, sensitive curriculum that showed positive outcomes for individuals who didn't have access to resources for diabetes education, specifically as it related to food and eating and other things. From an international perspective, I've done a lot of work on HIV and AIDS, where a lot of times folk focus on the medicine, but they forget about the fact that food and nutritional status is very important. So we've done some work in Botswana and Tanzania. And more recently, I'm doing work right now in Malawi, also some work in South Africa, where I'm originally from. So just for an example to show how all of this ties together. So if you look at the childhood obesity example, and I'll pick out a couple of things from the slide. On the far left is a thing that I think is something that we all should be concerned about. I see a lot of people have their phones here and iPads and laptops. But from a child's perspective, one of the things that was really, really groundbreaking in some of the work that we did was looking at child advertising through advertising games that are either through the computer or more recently also through, kids by the time they are 2 years of age can literally learn how to use a phone, but through those two media, but advertising of unhealthy food items that can definitely impact children's food choices. Okay, and then there's all the other things that we usually talk about, but I'm not going to go through all of those given the problem of time, but you can most certainly view some of those. So what are the implications, I think, of what it is that we do and what it is that we need to be focusing based on data that we've acquired? I think even though we have a lot of very useful data, a lot of publications out there, a lot of feedback and dissemination back to the community, a lot of curriculum that have been shown to be very effective, there's still a lot that needs to be done. I think important for us to especially understand how to deliver a very consistent but accurate message, but more importantly, again, from other work in various communities that I work in, is that information we deliver needs to be culturally appropriate. We cannot have a one-size-fits-all perspective on trying to solve these problems, especially as it relates to food. And then we also need to have appropriate services, and then some of the messages we deliver need to be appropriate. And then because my primary focus is underserved communities, I really think, I don't like to say necessarily low income, but I really think that we have underserved communities in a variety of different specs, and I think that it's very important for us to be able, as a result of our work, Michigan State is a land-grant university, and we deserve to give back we actually owe it to our communities to give it back to them, is how do we empower these communities to make healthful choices, especially from a food perspective, and improve their health at the same time, because like I said in the beginning, I'm interested in health outcomes. And I think this needs to be done. Education is always important, appropriate education, but we also need to think about the environment and then how can we impact health policies as well. Thank you.
Okay, we've got one question to get you started. If you'd read the question, and then we'll solicit other questions, either through Zoom or if in the audience here, please write that question down and we'll collect it.
Okay, so the first question is, what is the influence of fast food on obesity and diabetes? I think it depends on how we define fast food. I think, again, it's the choices that you make, and a lot of times you talk about all foods can fit. Most certainly, there are a lot of very high calorie, high sugar containing foods that are fast food, but I think that you can also make appropriate choices sometimes. And for those that make inappropriate choices, most certainly those that are high in calories, we do have an increase in obesity. And for those people who have diabetes, if they make inappropriate choices, it can impact their diabetes control. One more?
We have one additional question.
Okay.
If you'd read it first.
How does screen time impact food choices and health? I think from two different perspectives. So one thing is that, and I just saw a documentary the other day about the amount of screen time that we really should be concerned about, not just in children, but also in adults nowadays. But most certainly when we think about physical activity, the fact that at least with children, the recommendation is that they shouldn't have more than 2 hours of screen time a day. There are many children that have significantly, and just think about your own children if you have some of them, their phones, their computers, computer games, all of those type of things. And so when we decrease physical activity, we talked about that energy in and energy out. Most certainly, we've seen a lot of data to support the fact that that can impact our health status per se, especially weight status. From the other perspective, in terms of food choices, I said to you that we had some research that we looked at advertising games, both from mobile phone perspective, as well as from computer games that parents get free when they buy cereal boxes, and you get this little perk and the kids want the games. But what they really trying to do, and when we looked at the data, is advertise foods that are high in sugar and foods that are not necessarily the best choices for those children. So if they increase the demand or they increase the interest or the preference for some of these foods that are high in calories, most certainly that's going to impact weight status as well.
Okay. Thank you, Lorraine.
Thank you.